Hello everybody, my name is Martin. I'm excited to be here to tell you a little bit about Riverr. So it's 4 years ago, we were standing here at PIER71 as well. So it's been some time. And well, so what does Riverr do? So at Riverr, we are focused on providing insights that are de-risking an organization's operational overall risk. So what we are focused on is seafarers' health and well-being. And as you know, just as you can say, happy wife, happy life, it also means that you have a happy crew, and a healthy crew means a happy and well-performing vessel. So what we are seeing with companies like Apple transitioning, just announced transitioning their CO2 from air to sea transport, they have a reduction in CO2 of 95%. But this comes with a hidden struggle where the maritime industry is facing a 5 times higher risk of developing chronic disease. So there's a 5 times higher risk of developing chronic disease working in the maritime industry. We together in this room need to fix that, because that means that we are having a challenge of retaining and getting people to work in the industry. We also have a challenge as we are responsible supply chain to bigger corporations that we need to activate the change. And it's around almost $1 billion US is spent on repatriation cost due to illness and disease yearly. Average cost of repatriation is around $100,000, and 1.7% of all operations and deployments ends up in repatriation. When we dig into this and deeper into this, we find out many of these things is lifestyle-based diseases. These are not easy to change, but together we can create the organizational support to make this happen. So 70% of the total cost could be avoided. They say from $1 invested in preventive means 8 times return on that $1. So there's really a good business in this. So what do we do? How do we solve this head on? So with Riverr, we have 2 parts to this. One is what we call a workplace health intelligence tool. It basically creates visibility into your population's overall health, but also gives you suggestions to what you can do actually to mitigate that risk. It comes with suggested actions you can implement. You can roll this out widely in your ecosystem. So from the individual, the seafarer, we have an app as well. It comes with risk and is based on research that is already established in the medical sector and life science. Bringing that in, we are taking already existing data from your pre-employment medical examination, your health screenings. We can ingest that, and that is basically giving you, all of you, a very, I would say, easy to understand risk contribution and breakdown of your risk. So you can start working with that. So another thing of our platforms here at Bedrock, we see Bedrock is the company's foundation for better health in the industry, is to try and measure your impact and measure your current impact on how well you're performing. So this is a world first, not just an industry first, this is a world first where you can do an impact analysis and see how you compare to your benchmark and your peer. How do you stack up? So together, we are driving innovation through partnerships. You can get started with as a technology provider. You're seeking technology providers with existing system providers. We can start on a research basis or as a commercial opportunity with companies that are prioritizing the health and well-being of people. So we are rolling this out currently in the maritime industry, and we see that the investment really pays off. So if you're very fast, you can scan this QR code and we can do a free impact analysis on your company. It's free, and I think everybody in this room plays a role in a person's health. Thank you for your time.